Talking about the lower third of the face. I kind of break the face into thirds when I analyze somebody's face. You've got your forehead and your eyebrows, your mid face that includes your eyes and your cheeks and your lower lids. And then the lower third includes the areas where the masseter sits, where the buccal fat sits, where your jaw line is or your mandible. When someone comes to me and says, I want to slim the lower third of my face, I want filler. I always say, okay, filler adds volume. If you want something to truly be slimmer, you have to take away. And then I try to discern, looking at them, are they fuller up here, kind of in the front part? Are they fuller back along the jawline? If someone has relatively large masseter muscles, that's the jaw muscle that sits right here. And if you put your hands right here and clench your teeth, you can feel that muscle. So if we inject that muscle with a neuromodulator like Botox, it decreases the muscle's ability to fully contract. Over time, through repeat injections, you can see some degree of atrophy of that muscle, which contributes to a slight slimming. Buccal fat removal, on the other hand, is where we take out part of the fat pad that sits in the cheek about right here. Now, when we're young, it's up here. When we get older, it starts to sag and comes down a bit lower. Buccal fat pad can be reduced via two approaches. If you're just having that procedure done, I can make an incision on the inside of the cheek, on the lining of the mouth, and gently pull that fat out from where it normally lives. Conversely, if a patient's having a facelift and has an incision over here by their ears, I lift all that up, and then I encounter the buccal fat as I dissect more medially. And so if a patient would benefit from it intraoperatively, I go ahead and tease out part of that fat pad as well. It really depends on the patient, their anatomy, their specific facial structure.